Car park healthcare. Makeshift triage tents set up to manage a growing influx of patients waiting as long as 10 hours for emergency treatment.
What we've done is set up these transfer teams that have a qualified paramedic working with a range of other first responders, often student paramedics or St John first aiders, to care for those patients until they can be transferred into the care of the health service.
The situation's so dire, the Defence Force is being brought in to drive ambulances.
We've got close to 500 partners working with us to help us crew them with qualified paramedics.
In the last 2 weeks, demand for ambulances has hit record highs, the service recording 4 of its 5 busiest days in history, and the worst is yet to come.
We're probably going to see more people die as a result of not being able to get an ambulance.
Already, lives have been lost. 2 people suffering from cardiac arrest dying just this week after 000 calls went unanswered for 5 minutes.
We want to answer 90% of our 000 calls within 5 seconds. But right at the moment, we're not able to meet that simply because of the volume of calls that we're getting.
While it's Victoria's health system currently under siege, other states face similar risks as they begin to open up. States and territories demanding more hospital crisis funding from the feds.
We need to make sure we get the people vaccinated and the hospitals prepared. And I'm not going to put Queenslanders at risk until both of those issues are sorted out.
Well, I'm not going to respond to shakedown politics in a pandemic.
The bickering doing nothing to help at-risk patients, broken healthcare workers and a system on the edge.
We know that COVID has had an impact, but we actually went in with a system that was broken. And then when we come to a point like this, a stark increase in demand, the paramedics have got nothing left.
Well, Dr. Stephen Parnis is an emergency physician on the front lines in Victoria. He's also a former Vice President of the AMA. Stephen, most of us have no idea what it's like inside the health system right now. What is it like?
It's been rough, Hamish. I would say that it's also traumatic. The numbers of patients coming through the door, not just with COVID, but those without COVID, is getting to levels that I haven't seen probably for many years. The fact that we're dealing with an airborne virus means that everything that we're doing takes a hell of a lot longer and is a lot harder through PPE and through the fact that we have to retrofit buildings for things that they were never designed to deal with.
Well, the Victorian Health Minister noted today that there's a 3 to 4 week lag between case numbers and hospital admissions. How do you feel seeing today's numbers and knowing what's coming in a month from now?
Yes, we have enormous trepidation. I can't wait for this year to be over. I think the way that we look at this is that we focus on the next shift. We work as a team to try and make the changes that we need to get past the sorts of numbers that we have. I'm seeing measures being adopted that I have never seen in Australian public hospitals in my 30 years, but we know that they're necessary. People are not standing on ceremony now. They want to try and get a fix that we can until we get past this enormous wave.
Doc, my heart goes out to Victorians at the moment. It's just so hard to see those numbers. And we're now talking seriously about emergency triage measures. For anyone turning up at hospitals in Melbourne and Victoria in the coming weeks, what will that look like?
Well, it means that, for example, in the provision of emergency care, we are trying to separate those who do have COVID or may have COVID from those who we think do not have COVID. And that means taking up parts of the hospital that we haven't used before, keeping them physically separate. It means that people are often sent to parts of the hospital that we would never use outside of the pandemic. And we've got people in jobs that they usually wouldn't have as well. And that's because we need all hands on deck. And the scarcest resource at the moment is not the equipment, it's the people, because it takes years to train up medical and nursing experts.
Doc, last time we spoke, you told me about some of the strongest doctors and nurses that you know starting to have wobbles because the pressure is so great. We're now further down the track. The admissions are higher. The COVID cases are higher. Are you having wobbles? Are the others having wobbles?
Yeah. It's not easy. But we just count on each other. We get through a day and we think about the people that we can look after. I'm sorry.
You doing okay, Doc?
Yeah, I'll be fine. I've got a great group of people to look after me, and I know we'll get through this. I'm vaccinated. I've got a wonderful team around me in all of my hospitals, and self-care has become a bit more of a priority in recent times.
Well, Doctor, as a fellow Victorian, we are all incredibly grateful and appreciative of your efforts. Can I ask, we've seen requests from the states of the federal government asking for more crisis hospital funding, but the suggestion back from the federal government is that the state health departments haven't prepared well enough. How do you see it? How do you see it from where you sit?
Yeah, I found the line of shakedown politics from the Prime Minister absolutely offensive. I've been watching hospital funding for the best part of 20 years. I used to be an AMA leader. I've seen the argy-bargy between state and federal governments of both persuasions over a very long time. I remember in the early days of the Abbott government a withdrawal from the 50-50 agreement for hospital funding from the federal government. It's now 45-55, and no amount of preparation could get you ready for this sort of scenario. And when you've got the federal government pushing like no one's business to get the states to open up, with the obvious consequence that hospitals will be hit by increased numbers of patients, then I think they need to take some responsibility. And so if they continue to adopt this approach of no negotiation over a once-in-a-century health crisis, then I think that they are abdicating their responsibility.
Dr. Stephen Parnis, thank you for talking to us tonight. Thank you for the work that you and all of your teams are doing, and take care of yourselves and obviously the patients as well.
Thanks very much, Hamish.
It's really disappointing to see, politics get in the way of outcomes. We're in the middle of a health crisis right now. What we need are politicians to put politics aside and work together, like we kind of saw at the start of the pandemic. You know, you're seeing here health workers that are pushed to their limits. We don't have time for this. You can do your politics later. Right now, we need solutions. We need help.
You're in Victoria, Naz. Is there a sense that this is overwhelming the health system, or is everyone, like most of the rest of the country, focused on what's on the other side of this?
Every person that I know that works in a hospital is reporting how overwhelmed the hospitals are, and they're just exhausted. We're all pretty wrecked and tired at the moment. I mean, the light's at the end of the tunnel, but we've been walking for a long time. So I think what we need is support. We need to put the politics to the side right now. We pay politicians to do a job. Right now, do that job. We don't have time for, or the energy to put up with this sideshow.
Yeah, absolutely.
Hey there, it's about time you finished that video. I contractually had to wait so I could tell you to subscribe. Subscribe. I'm waiting. Now I can go home. Woo!